Hi everyone, Dr. Reams here with Dr. Reams Concierge PT. I'm here today with Dr. Purman. She's an optometrist. We're going to talk a little bit about what cancer treatments, such as chemo, immunotherapy, radiation, can have the effect on the eyes and kind of what you can look out for. So welcome.
Hey, thank you very much. So I think the most important thing, no matter what kind of treatment you're getting, is getting an exam with your optometrist and just getting that baseline.
Before treatments.
Yep, before you even start treatments, because what's normal for you might not be normal for someone else, and you might even have like a freckle or something you didn't know about in the back of your eye before treatment, and we really want to know if that was there before or after treatment, because that makes a huge difference.
Yeah, absolutely.
So I think that's always the first step. And then, so depending on your treatment, if you're doing chemotherapy, probably the most prevalent thing you're going to see is dryness. So you might experience burning, itching, redness, or tearing. And sometimes you get that like epiphoria where you just keep getting the tears that keep running down the cheek.
Oh, that's called epiphoria?
Yeah.
Oh, cool.
Just continuous tears. And sometimes that's from, like if you're getting radiation of the head specifically, the puncta where your tears drain out can actually kind of shrink. But for dryness, there's a lot of over-the-counter eye drops. The ones that say redness don't work for dryness, so I wouldn't necessarily get those. But if you go see your optometrist, there's so many different types. They can help, wean down which over-the-counter ones would be best for you.
Yeah.
And then sometimes over-the-counter drops just don't work. They're not strong enough. So
As with anything over the counter, right?
Yeah, exactly. So there are stronger, there's prescription dry eye drops, there's treatments other than drops. If you're someone that absolutely hates dry eye drops, that doesn't have to be your treatment.
Thank goodness for if someone like me had that problem.
It's pretty common. Most people don't like eye drops, so there's definitely other options out there, and so that's why you want to see your optometrist.
Yeah.
And figure out what works best for you, really. And then, some of these drops are really expensive. You want to know if it was worth it or not.
Yeah. And if someone starts noticing these symptoms, should they talk to because they've got a healthcare team at this point, right?
Yeah.
So radiologist, surgeon, PCP, does it matter?
It's always good to let them know, but I would also talk to your optometrist too about what specific brand. I mean, they might recommend a brand too, and it's always good to keep everybody in the loop. You want to tell them what symptoms you're experiencing, especially to make sure it's normal for your specific treatment.
Yeah.
But that one specifically, I would get your optometrist involved, but I would keep everybody in the loop with all those symptoms.
Yeah, medications start to interact that you don't even realize.
Yeah,
usually drops
exactly.
are pretty safe, but
yeah, and it could be something very specific to your treatment, and you'll only know that if you talk to whoever's treating you. So that's a good idea too. And then radiation causes its own thing. I don't think that's quite as common, but specifically head up, like melanoma on the face or something like that. Big tearing. Sometimes you can get changes in the back of the eye. It's called retinopathy. So your retina is the red layer. It's like what processes the light, sends it to your nerve, and then it goes to the brain.
Mm-hmm.
So that's why you want to get dilated with your eye doctor. So that's really important.
Yeah, I love that when I saw you.
Yeah, nobody loves dilation. That's super fair. But I promise it's important because dilation's like, instead of having to look through a keyhole to look into a room, dilation's like opening up the whole door. So you're gonna see so much more. You're gonna catch those little changes. For certain like drug treatments, like with chemotherapies, sometimes the changes are reversible if we catch it soon enough.
Which is awesome.
Yeah, so that's why you really want to get that baseline to see what's normal, and then obviously if you notice any changes at all in your vision, you start getting blurry vision, especially like your center vision starts changing, colors are different, you're having light sensitivity. Don't wait, go in and get an eye exam sooner than later because some of it can be, fixed.
Like anything else, the sooner we catch it, the easier it is to manage and possibly even reverse.
Exactly. Specifically like tamoxifen for breast cancer, that causes a very specific type of retinopathy in the back of the eye that causes central vision loss and color change. So if you experience any of those two things, you definitely want to let your optometrist know right away, and you also want to let your oncologist know right away too, because sometimes that's tied in with like duration. So it normally happens like after a year of use, and it is really related to the dose. So sometimes, you want to let them know because you might have to either switch treatments or you might have to lower your dose. So you want to keep everybody involved there.
Yeah. Some of these symptoms may happen during the treatments.
Yep. Yeah.
Some can happen later on, right? Kind of almost like a build-up effect.
Exactly. The longer you're on some of this stuff, and then you might keep dry eye for life. So there's some things that might not go away after the treatment, and there's some things that are going to happen just specifically while you were on those drugs. And it's really just dependent on you. Everybody's a little bit different, and it depends if you had symptoms. Like if you had dry eye going into it, you're probably going to have it after it, but it's going to most likely be worse during your treatment.
Yeah. And so keep an eye on the symptoms, getting your baseline, talking to your healthcare team is very, very important. And like she said, a lot of this stuff, or some of this stuff, can even be reversed or very easily managed if you talk to someone sooner rather than later.
Yeah, I definitely don't recommend waiting. And then another treatment too, if you get put on steroids, you know, to help with symptoms from the treatment, that one I would prefer you get in sooner to be seen with your doctor.
Okay.
So some people are what we call steroid responders, and you honestly really don't know until it happens to you. So
what happens?
Your body is just extra sensitive to the steroid, so your eye pressure is going to shoot up when you take a steroid. You know, oral, IV, you know, even an eye drop can make your eye pressure go up. And when your pressure goes up slowly, you don't necessarily notice a change, which is why it's kind of scary. But when your pressure goes up, it's putting you at risk of glaucoma, and we have that specific steroid-induced glaucoma.
Interesting.
And with glaucoma, the effects aren't reversible. So before taking a steroid, it's good to get your baseline eye exam because we want to know what your pressure is before the steroid. And then 1 to 2 weeks after starting, that's when you're most likely to get a pressure spike. So that's when you want to go in for your follow-up. And then more often if, you know, they feel like you need to be watched more closely.
Okay.
But that one's super important, and not everyone remembers that, especially because some steroids are over the counter, like Flonase. Like, I've had people like cough, like, you know, like common colds come in and they have pressure spikes, and really needs to be treated immediately.
Yeah, I'm thinking about I just got put on steroids after I had pneumonia.
Yeah, exactly. And sometimes, you know, that's not the common side effect you hear about. And most people aren't steroid responders, but if you are one of those people, it's really important you get that check after.
Interesting. Okay. So that's a new one. I hadn't heard of that one.
No, most people don't. And then sometimes even, you know, your doctor gives you something and it just sounds common, so it's easy to kind of get lost in that loop. But
And then I know one thing that's out there kind of on the internet and stuff is that some of the chemos, the word tamoxifen again, can cause glaucoma.
Yes.
Where is that link? Kind of what do we look out for?
I think the glaucoma really with the steroid.
Okay.
And then sometimes you have to watch out. There's certain drugs that kind of like shift parts of your eye forward. It's like closing the area where the fluid drains out in the eye, or sometimes side effect of medications can kind of increase fluid production, decrease. So glaucoma, the pressure goes up in the eye, you're getting damage on the nerve, and that damage isn't reversible.
Okay.
So, you know, even if you're getting a high pressure, it doesn't mean we necessarily have to take you off the treatment. But we need to then add in a drop to bring the pressure down.
Okay.
So, you know, I wouldn't say glaucoma is as common with the other things, but for sure with steroids.
Okay.
It could happen though, and then you might just have more of a genetic predisposition to getting glaucoma. It runs in your family.
Yeah.
You know, there's different things that kind of lead to that. So that's where it's, again, good to get that baseline to see, are you already high risk for it going into this? Do we need to watch you a little bit closer? Maybe a year follow-up isn't enough. Sometimes doctors want you watched at 6 months. Sometimes it's sooner, just kind of depending. Some people just have, we call it like narrow angles in the eye, so where the fluid drains out, it's already kind of tiny. So it's good to know if you're one of those people prior to going into this treatment.
Gotta love the human body. It varies so much.
Yeah, exactly. Your normal and my normal are different, and that's why the baseline is really important to figure out what was your normal prior to starting.
Now, would any optometrist be the one that they go to, or is there something they should look for in training or anything like that if they're not here in Chattanooga with us? How would they find someone that they know would help them with these kind of things?
That's a good question. Really, you should be able to go to any optometrist, but there are some that specialize more in disease. I did my residency in ocular disease, so that's definitely my preferred. You know, I enjoy more of the medical treatment. There are some places that don't take medical insurance, and normally that is a sign that they don't really do as much medical eye disease. Certain chains specialize more just with vision, glasses, and contacts, and that's fine. And chains can manage medical conditions. It just kind of depends on that individual doctor. So when you call, the biggest thing, if they take medical insurance, they probably do medical, which this would fall underneath with medical eye disease. Most private practices specialize with, ocular disease. That's always safe. And then a lot of times you'll get these combos of a MD, OD, so optometrist and the surgeon, and they always specialize with disease for the most part. So that's always a safe bet.
So if you call in and ask, hey, I'm about to have cancer treatments, or I just finished cancer treatments, if they didn't catch this video beforehand.
Yeah, it happens. I have people come in like 3 years after.
Yeah, and just say, do you treat people with this? Am I okay to come here and you check out what I think may be related to this, or baseline before I go do this, and kind of clear them before you go in and see them.
Those are great questions. Normally the receptionist will know. If you just ask, do you treat medical eye conditions, for the most part, if that doctor treats like diabetic eye conditions, do they treat glaucoma, do they do like with Plaquenil, patients that are on Plaquenil need to be getting eye screenings every year. Ask, if they treat that, they also treat this, and you can just specifically ask too, I'm getting chemo, would this optometrist be able to manage it?
Wonderful. That's great to know, and always good to see the right doctor for you, because like you said, there's other ways you can kind of specialize in every medical profession, so making sure the person you go to can help you.
Yeah, because there are definitely some doctors that specialize just in contacts or something like that, but normally, for the most part, I feel like a lot of optometrists we're like your general eye doctors.
That's
we
awesome.
do a little bit of everything.
Yeah, that's very, very helpful.
Yeah.
Thank you so much for being here today.
Thanks for having me.